As the leaves begin to change and fall and the temperature starts to drop, seasonal affective disorder may be setting in. Dr. Michael Cummings from ECMC is sharing tips on how to stay positive through the fall and winter months. Good morning, doctor.
Good morning.
It's timely. It is that time of year. We are certainly noticing the weather over the past week or so has been falling after we experience a nice start to fall. Recap just for us, seasonal affective disorder, what is it and how does it maybe differ from depression?
Yeah. So I mean, depression, people are familiar with that. About 21 million Americans will have it in any given year. You take major depression, the disability from major depression is more than all of cancer and all of heart disease combined. And when we talk about depression and major depression, we're talking about changes in sleep, energy, concentration, changes in appetite, maybe feelings of guilt, hopelessness, helplessness, and in severe cases, suicidality. Seasonal affective disorder, or SAD, is similar to that. Typically begins in October, November, peaks January, February, and then starts getting better again in the spring. And people who tend to have seasonal affective disorder tend to have it year in and year out. A couple things are a little bit different. It's almost like a state of hibernation. There's often increase in appetite, weight gain, social isolation, and it's a serious condition. It's not simply kind of having winter blues.
If you recognize those symptoms you just referenced, how can you intervene if it's a loved one or if you yourself are noticing it in yourself? What can you do?
Yeah, so it really comes down to, well, first and foremost, your primary care provider is really the first front for this. They're trained to screen for this and treat it. There's a lot of treatments similar to depression, but they differ a little bit. Exposure to natural sunlight can be very healthy. We have to balance that with risk of skin cancer and things like that. There are light boxes that you can buy. These used to be very hard to come by and they were expensive, but now you can get them online for relatively cheap. And it's a very bright light. You have to make sure you get the right type, and people tend to get up in the morning and you kind of, it goes into the side of your face for 20, 30 minutes a day. That can be effective. Certainly therapies in more severe cases, antidepressants, and other treatments like that. And then some people who are vitamin D deficient, we supplement vitamin D, which can be helpful.
And the first stop you reference, your primary care
doctor.
It's
really your primary care, yep.
Okay.
They can get you linked up with a mental health provider or a therapist if you need more than that, but they are really the first line of defense.
All right, doctor, thanks so much. Important information. Appreciate
Thank
you
you.
coming in.